If you go to page 1296 of the House bill, the engrossed copy, and you begin to read in Title III of that bill on preventive and wellness services, and you get down to section 2301, this is what happens. In section 3131 of that bill, it changes the Preventive Services Task Force to the Clinical Preventive Services Task Force. Then you go back and you see that that task force on preventive clinical services is tasked with rating A, B, C, D, or I, all preventive services. Then you go back into section 222 of the bill,
and
it says, yes, I have read this bill, and that indicates what will be paid or covered. And this is where the actual link comes, and I'll read it for you. In section 2301, it says, all recommendations of the Preventive Services Task Force, that's the group that did the mammograms, and the Task Force on Community Preventive Services as in existence on the day before the date of the enactment of this act shall be considered to be recommendations of the Task Force on Clinical Preventive Services.
The point is that the guidelines
they become the law. They become the law, the mandate.
No, they would not be. And
yes, they do.
What's unfortunate is that the Republicans and Ms. Blackburn have, for the first time, politicized breast cancer.
That is incorrect.
No, it is not. And I'm as you know, as a breast cancer survivor, Marsha,
it's still a bill, Debbie, and I have great respect. Yeah.
As a breast cancer survivor, I came out against these recommendations. Every major cancer organization has come out against these recommendations. The task force language in that bill actually makes sure that preventive services like mammograms and colonoscopies and other cancer screenings would be free. The task force recommendations, the language in the bill ensures that more women would get access to preventive screening.
Excuse me for a second. That is true, but let me clarify a little bit, because under the bill, and we have the language as well, it says that a group health plan and health insurance that you're offering a group shall provide coverage, but only under if the Preventive Services Task Force rates it as an A or B.
That's right.
And actually, under the task force, they said that these mammograms for women 40 to 50 is rated C, so they actually wouldn't be covered. So you'd have a great expansion for a broad part of the population, but actually these guidelines would be controlling for ages 40 to 50.